Good evening once more, distinguished speakers, panelists, partners, and members of the One Health community joining us from Africa and around the world. It is a true honor to welcome you to the One Health Summit Africa. On behalf of the organizing team at the One Health and Eco-Sustainability Initiative, together with our partner organizations, we are delighted to convene such a vibrant and dedicated community of professionals, students, and researchers, working at the vital intersection of human, animal, and environmental health. Over the next 2 days, we will hear from exceptional voices diving One Health actions across Africa and beyond. This summit is more than just a gathering. It is a platform for learning, collaboration, and inspiration. It empowers both emerging leaders and seasoned professionals to translate knowledge into meaningful action within their communities. I'm honored to serve as one of your moderators for this summit, and I am Aza Albright. Joining me are my esteemed co-moderators, Mr. Jeffrey Awede, Mrs. Akinola Enyola, Ms. Ogwecha Emanuela. Together, we will guide discussions, facilitate conversations, and ensure an engaging experience for all. We encourage you to participate actively, ask questions, and take full advantage of this unique opportunity to connect with fellow One Health advocates from across the globe. Welcome once again, and let us embark on this journey of shared learning and collective action. For those joining us or tuning in live from YouTube, we are excited you are here with us, and we hope you are getting as much value from the summit. Now, it's a privilege to invite Dr. Ondu Jacob. He's the founder and executive director of the One Health and Eco-Sustainability Initiative. He's also the chairman of the organizing committee. He's going to deliver a warm welcome address. Dr. Ondu Jacob, please, the floor is yours.
All right. Thank you very much, Bright, for the warm welcome. Distinguished speakers, our esteemed panelists, our valued partners, senior One Health professionals, One Health participants all across the African continent and around the world. Good evening to you all. I am very delighted and honored as the founder and executive director of One Health and Eco-Sustainability Initiative to welcome you to this landmark event. Africa, like every other continent around the world, faces complex challenges at the intersection of human health, animal health, and environmental health. From emerging and re-emerging diseases to antimicrobial resistance to environmental degradation and food system vulnerabilities. These realities affect our communities and our future. Yet within these challenges lies a defining opportunity, an opportunity for leadership, innovation, and coordinated action, an opportunity for a new generation to rise and help shape long-lasting solutions. This summit was created with a clear vision to empower, connect, and equip young people to move beyond awareness into action. We recognize that the future of One Health depends on building strong networks, strengthening capacity, and creating platforms where ideas can grow into solutions. This summit represents that commitment. The theme of this summit, Empowering Youth for One Health Action in Africa, reflects our vision to strengthen youth leadership, encourage collaboration across sectors, and position young professionals as active contributors to advancing One Health on the African continent. The summit is proudly hosted by One Health and Eco-Sustainability Initiative in collaboration with our valued partners, Vet Connect Limited, Vet Bridge Network, One Health Access Network, Cameroon, International Veterinary Student Association, IVSA Nigeria, Nigeria Veterinary Medical Student Association, and Nigeria Medical Students Association. These are all youth-led organizations demonstrating that young people have the capacity to lead meaningful change. We also sincerely appreciate the senior One Health professionals joining us today. We've seen a whole lot of professors and senior experts here. Your leadership, mentorship, and continued contribution have created pathways for young professionals to grow, lead, and contribute meaningfully to this field. We are grateful for your presence and your support. We are proud to welcome over 1,000 registered participants from more than 40 countries across Africa, Asia, Europe, and South America. This shows that One Health knows no borders, and that One Health community is growing, and that young people are ready, and that the world is ready to collaborate, learn, and act together. Over the next 2 days, we will hear from 6 distinguished speakers and 6 expert panelists whose experiences span human health, animal health, and environmental health. Their insights will challenge our thinking, deepen our understanding, and inspire new pathways for action and collaboration. Bringing this summit to life was not without challenges, but through shared vision, partnership, and unwavering commitment, we transform obstacles into progress. And this is only the beginning. We look forward to future editions that will reach even more countries, engage more partners, and expand opportunities for young people across One Health ecosystem globally. As we begin this historic summit, let me leave you with this thought. The future of One Health in Africa will not be defined by circumstance. It will be defined by the courage, the commitment, and the leadership of people like you. Once again, I want to welcome you to One Health Summit Africa 1.0, and I wish you all the best in this summit. Thank you. Over to you, Bright.
Thank you very much, Dr. Jacob, for that inspiring and visionary welcome address. It truly sets the tone for our summit, and thank you for shining light on the young people, because indeed, the change starts with us. At this time, we are honored to receive a goodwill message from the Trinity Challenge, a global initiative driving innovation to combat antimicrobial resistance and strengthen global health security. Through challenge-led funding, data-driven solutions, and youth engagement programs. The Trinity Challenge is advancing practical actions that strengthen antimicrobial stewardship, surveillance, preparedness across human, animal, and environmental health systems. We are especially pleased to hear from Jenny Smith, who leads youth engagement at the Trinity Challenge and champions young people's participation in global AMR action. Please join me as we receive their recorded goodwill message.
Hello everyone, my name is Jenny Smith and I lead on youth engagement for the Trinity Challenge. I am delighted to be sending greetings to the One Health Summit in Africa today, a gathering of young professionals from across Africa and beyond. As a lot of you know, the theme of this summit is empowering youth for One Health action in Africa, and it really couldn't be more timely. The challenges we face in global health go across borders, they go across sectors and across disciplines, and they demand exactly what you're building here today, which is cross-sectoral collaboration, bold leadership, and youth empowerment. At the Trinity Challenge, we've seen firsthand what happens when ambitious ideas meet the right support. We get innovative solutions and really fantastic campaigns that tackle antimicrobial resistance. The solutions that will shape the future of global health are being developed right now, and often by young professionals like yourselves. As we know, Africa is home to some of the world's most pressing health issues and challenges. But at the same time, it's home to some of the most innovative solutions. And this summit is really proof of that. We are so happy to see some of our Trinity Challenge youth competition winners presenting and in attendance at this summit. And we're very proud of what they've achieved over the last few years and their continued work to tackle the antibiotic emergency. To every young professional here, we want to say that your voice matters, your ideas matter, and you're already doing the work. You're building networks, you're challenging assumptions, and really pushing for the cross-sector collaboration that's needed. This is really how change happens. So finally, we want to say thank you for your dedication to One Health. And we know here at the Trinity Challenge that the future of global health is in great hands. Thank you.
Thank you very much for sharing. The Trinity Challenge lead message really struck a chord, didn't it? Very insightful. Next, we are honored to receive a goodwill message from Dr. Kikiope Oluwarore, Executive Director and founder of the One Health and Development Initiative, a leading voice in the One Health space. Dr. Kikiope has championed efforts in zoonotic diseases, prevention and antimicrobial resistance, and community-driven health solutions. Her organization has also developed innovative platforms such as RORE, strengthening data-driven interventions and youth engagement. We are privileged to hear her insights and encouragement at this summit. Please join me in welcoming Dr. Kikiope to deliver her message. Doctor, the floor is yours, please.
Okay, can anyone hear me? Am I audible?
Yes, you are audible.
Okay, all right then. Yes, so good day, everyone. Good morning, good evening, good afternoon from everyone joining across the world. And really, I mean, it's really an honor and I'm happy to share this goodwill message at the One Health Summit Africa, which I believe is the first. And so to start with, I want to, commend the organization One Health and Eco-Sustainability Initiative led by Jacob Ondu for convening this very important dialogue with the theme Empowering Youth for One Health Action in Africa. It's really an amazing feat, and I know I can imagine how much preparation has gone into this conference, how much, conversations, investment in time and resources that have gone into this. So I really applaud you and the team for convening this important conference. And it's also remarkable the response that has been seen to this summit is a testament to, knowing that the future of health in Africa is built through collaboration, innovation, and leadership, especially from young professionals. And just to give a bit of a background, we all know that Africa faces complex and interconnected challenges. And many of these do not exist in isolation. They actually intersect. So if the challenges are interconnected, then the solutions must also be interconnected. And that's why One Health is here as a framework for survival and a pathway for sustainable development. And at the heart of this, which is the reason why we are here, are young people. Young people across, whether you're a veterinarian, young medical doctors, young environmental scientists, young innovators, young researchers, young public health professionals, young agriculturists, environmentalists, and everybody who, is connected to the One Health network or the framework is really important in this. You are all important and you are all architects in this. But we also know that apart from just knowledge about One Health and advocacy, just building on some of the things that Jacob had also said, we must go beyond inspiration to actual action. And action in this case for young people includes things like access to knowledge, access to mentorship, access to opportunities, leadership platforms, access to funding, very, very important, access to innovation pathways, and access to policy engagement spaces like what we have here. This is a very important space for such conversations. And as young professionals, your role is not just to participate in all this, but to also reshape them. This is, I remember starting the organization, starting my career as a young person. When I mean young person, I mean under 25. And it reminds me of the journey that I also took for myself to be able to build a career, or to build this kind of, momentum and building into what I have in One Health today. And I see a lot of opportunities also for young people who are in this conference to be able to make use of, being a youth and being able to contribute as much as possible to the One Health space and to really take action. So in our work, we have seen that young professionals, when they are given the space, the responsibility and trust, they actually do transform systems. We have seen examples of this in my organization, One Health and Development Initiative, where we have led several young youth-driven conversations and actions in communities across the world, particularly in Nigeria and also across the world, and seeing how young people can actually transform systems as much as possible. So to conclude, or maybe before I conclude, we know that the future of Africa's food systems, or we can agree that the future of Africa's food systems and surveillance systems and environment and, public health and everything will depend on your ability to take action and to collaborate in this action and act practically. So let the summit be a platform for the beginning of new partnerships and initiatives and strengthening of youth-led innovation. And to the organizers, once again, thank you for creating this platform, this summit. And to the participants, I encourage you to engage deeply and connect and think beyond your discipline, and really see it as an opportunity, as a launching pad for the amazing opportunities that you can take within the One Health space. And not just the opportunities to, to learn, but also to make impact as much as possible and to build a career that is fruitful and that is impactful to the entire world. This is the Africa that we want. We want, Africa that is resilient, that is healthy, that is food secure, that is environmentally protected and prosperous, and is possible with coordinated One Health action that is led by empowered youth. So I wish you all a highly productive and inspiring summit, and thank you very much for having me to provide this goodwill message. Thank you.
Thank you very much, Dr. Kikyope, and we appreciate your kind words, and they're insightful as well. Your goodwill message is a great start to our summit, and thank you for setting the stage. Next, we're going to kick off with our first session. It's going to be incredible and moderated by Mr. Jeffrey. Mr. Jeffrey, please, can you set the pace so we can dive in?
All right, thank you so much, Bright. It's an honor to be here in the One Health Summit. My name is Jeffrey Owede, and I'm chairing the Standing Committee on One Health, IVSA Nigeria. So we'll be taking our first speaker, Dr. Ashimani Atimailai Bitros, who is the head of Department Veterinary Microbiology and Pathology, Faculty of Veterinary Medicine, University of Jos. He'll be taking us on a very impactful session, Understanding One Health and the Power of Communication in Driving Collective Action. So right now, I'll be reading the bio of our dear speaker for today. Okay, Dr. A.A. Bitros is a veterinarian and microbiologist with extensive experience in veterinary diagnostics, antimicrobial resistance, and One Health research. Dr. Bitros is currently a senior lecturer and head of the Veterinary Diagnostic Unit at the University of Jos. and serves as the Director of Education and Training at the African Institute of One Health Research and Diagnostics. He has worked as a consultant and trainer with ICTAD, FAO, contributing to veterinary epidemiology and AMR national action planning. His work focuses on antimicrobial resistance, veterinary microbiology, and infectious disease diagnostics, with several peer-reviewed publications and competitive research grants to his credit. He brings valuable academic and practical perspective to discussion on AMRO and One Health. It's an honor to have here at the One Health Summit Africa Dr. A. Bitrus, which is our dear speaker for today's session. We are honored to have you, sir. The floor is yours.
Okay, thank you. Good afternoon, everyone from this side. Thank you, Jeffrey. Can you hear me all?
Yes, sir, we can hear you.
So thank you, Jeffrey, for the introduction. I really appreciate. The name is Asinamai Bitrus, so it's Asinamai, not Ashiamai. So that's on a lighter note. And then I'm the head of Department of Veterinary Microbiology, not Veterinary Microbiology and Pathology. Initially, we were one department, but later on, based on the regulations of the Veterinary Council of Nigeria, the department was balkanized into two. So we have separate microbiology as an independent department. So thank you so much. Before we go into the business of the day, I would like to greet everyone that is here on call, and also to appreciate Dr. Jacob and his team for the opportunity to actually be one of the speakers in your workshop. So it's a privilege to be here, and I believe in the course of the interaction we are going to have in the next few minutes, I hope to impact, to be part of the narrative going forward. And it's also a privilege to be the first person to set the stage for the discussion. I really appreciate that, even though I feel one of my students reached out to me, Ms. Wandu. I felt she set me up. So, but thank you so much. We're going to, into the presentation. I'll share my slide, and I'll try as much as possible to be audible, because I know my voice is a little bit cranky, but then I hope to deliver the task for the day. And also, I'm grateful. In fact, when I saw the theme of the year, Empowering Youth for One Health Action in Africa, I was a bit excited, because whatever you're doing, because the future of everything in the world, global health, you're looking at the economy and everything, is in the hands of the youth. And in all our conversations regarding policy development, if the youths are not carried along, I don't think we're going to make headways, because the next generation should be the movers of change in Africa and also in the world at large. So thank you once again for the leadership of this great organization, for the opportunity once again. So I'll begin to share my slide, and we continue from there. Thank you. If you wouldn't mind, I would like to, because my internet here is not really strong, so I would like to, I would like not to use the video if it's okay by you. Thank you. Can you see my slide, please? Can everybody see my slide?
Yes, yes. We can see your slide.
So thank you. Like I said earlier, my name is Asinamai Bitrus, but you can call me Bitrus. So I work with the Faculty of Veterinary Medicine, University of Jos. So for the presentation, we're all going to have a conversation on understanding One Health. Okay, great. So One Health and the power of communication in driving collective action. So One Health, we've heard about One Health, and the previous speakers already gave us a background on One Health. And I know that because of is an in thing now, and because of the things that have happened in the global health perspective as a result of One Health, we are not really naive to the information on One Health. And I don't know, sorry, please, Jeffrey, you asked me to prepare a pre-test question. It will have been nicer for the participants to answer before we delve into the presentation. I don't know whether it has been done, please.
Yes, sir. Yes, sir.
Okay.
The participants can type their questions on the chat box. Then
Okay.
I will the questions once you are done with your presentation.
No, what I mean for this presentation, I was asked to present a pre-test question to see, it's just for knowledge assessment, so that at the end of this presentation, there's going to be a post-test. So I don't know whether that has been done, so that we can properly evaluate whether there's a change in knowledge.
Yes, sir. That has been done very well by the moderator.
Okay, thank you so much. Thank you.
Yes, sir.
So basically, for my presentation, this will be our learning objectives. I hope at the end of these interactions, the participants should be able to understand the One Health concept, appreciate the role of communication in One Health, and also the link communication to collective action, because whatever we are trying to do is because at the end of the day, we want to institute intervention. We want to take actions that will change the narratives of health in Africa and at the world at large. And as apply concept to real world challenges, that's what we hope to achieve at the end of this presentation. So now, why this conversation matters? Why are we interested in looking at the power of communication in One Health? We know that over 60% of emerging infectious diseases are zoonotic, means they are coming from the animal, and of course, humans are the ones affected. So, but then disease doesn't occur in isolation. There's an interaction between humans, animals, and the environment. Then how do I intend to achieve a comprehensive health outcome without looking at these three key components of the One Health? So, and we know that because of climate change and globalization, people travel, urbanization, and population growth, things are changing. So no single sector can solve the challenges of One Health. That is why I like in the goodwill message of Dr. Kiki Obes, she said, challenges are connected, and why not the solutions? So the solutions are also connected. So we need to lay the foundation. Once we understand that, okay, 60%, more than 60% of all emerging infectious diseases are zoonotic, then because of this climate change, globalization, people move in have this conversation so that the next pandemic is not going to take us unawares. We'll be fully prepared, and that's why I'm so happy and so excited that I'm talking to young people, because you are the future of the next generation. So that's why this conversation matters. But then, whatever we are going to do, if there's no proper communication, if there's no proper implementation, so you won't achieve proper implementation, there's no proper communication of ideas and the challenges. People, sectors need to talk. It's not enough to say One Health is a disciplinary approach. No. So is there communication between these sectors? And if there are communications, along what purpose or along what line are we having that conversation? Are we together, please?
Yes, sir. We are together.
Thank you. So what is One Health? Basically, we all know the definition of One Health is a collaborative multidisciplinary approach recognizing the link or interconnectedness or connection between human, animal, and environmental health. These three components are linked. You can't have disease without the involvement of either the environment or either the animals or either the humans. Because even the pathogen itself that is causing the disease, or for example, non-infectious, they are all tied to these three entities. Then how do we now achieve a better health outcome? Is for us to start coming together, changing the narrative, start having conversations amongst ourselves. Okay, for example, if there's a disease that affects humans, should it be handled by only the medical doctors? Because there's also the involvement of the animal, there's also the involvement of the environment. So, and among these three sectors, I believe they should have an all-encompassing, they should operate at an equal standard, because there's no sector that is higher than the other. By the time you start having issues of superiority, even communication will not take place. So that's why it's good for us to understand the concept, and it's collaborative. That is the key, collaborative coordination. That is the key for One Health. Then if you look at this picture, basically, you see what this toddler is doing. You know, these are things we cannot ignore. There's no, even in terms of the animals we keep. Now, you understand, let me give an example with dogs or pets generally. The circumference of pets is even changing. There are animals that ordinarily we don't see them as pets, but people are keeping them as pets. And these animals have certain pathogens that are not compatible with humans, or that are not naturally found in the human population. There's this constant interaction, just like we said, disease does not understand geographic boundary. There's also no definitive boundary now between humans and animals. Look at what the toddler is doing. He's trying to kiss the snout of the pig. Now this pig is harboring, swine influenza is zoonotic, right? And this is a toddler. And we know, even if we're going to go medically in the convention of immune system, the immunity of this child is not really solid. So, and how do we achieve, now assuming this child falls sick and they take him to the hospital? Basically, the doctor there needs to ask questions around whether there's contact with animals, whether the environment have animals around or stuff like that, because certain diseases are only specific to animals, or they are shared between two. We have shared risks and we also have shared solutions. That is why it's very, very key for us to understand One Health, looking at the concept. It's an interaction between what the human environment and the animal health. And now going beyond these three key sectors. Now, when you're talking of the human health, animal health, and environmental health, so you come up with beautiful ideas, beautiful documents, beautiful guidelines. How do you communicate these guidelines? That's why communication is key. That is why we need the media too to be part of it. I like it for this, the young generation, they call you the Gen Zs. You are more computer or ICT compliant. And if you look at, you can come up with short clips, short videos that will speak to the people about One Health. So no matter the beautiful documents we have as either government or coming from the research institution, like for us in the academia, you do a research, you publish. Most times we do it for promotion or to get international collaboration, but is it solving real life problems in our immediate community? The concept of writing in published articles is actually different for communications. You want to change behavior of people. So that is why it's very key also involve other stakeholders that are critical to what achieving the One Health implementation plan. Are we together, please?
Yes.
Yeah, I need to be asking so that I shouldn't be talking to myself. Thank you. So basically, One Health, looking at the One Health plan, this was adopted at the global level, and at the local level, I think Nigeria is one of the countries actually that have their own One Health strategic plan, even though this is 1.0, I think the second document is coming up. And if you look at one of the strategic goals in our One Health plan is increase awareness. And how do we increase awareness without what? Communication. First, you need to ensure that, yes, you have a plan, and this plan was signed by the three ministers then, and also all the key sectors, the human, the animal health sector, the environmental health sector, actually working together. In fact, I saw on the page of the Nigerian Center for Disease Control, I think in December, they were trying to support implementation of One Health teams at the state level. At the national level, I know it has been working, it's superb, and they've achieved a lot. Even the AMR National Action Plan was designed based on One Health, because all the three sectors are involved in the development of that document. I happen to be part of the animal health sector when we developed that document. So we already have, and communication or increasing awareness is one of the key goals in the world global and also the Nigerian National Action Plan. And I believe it applies to other countries too. Because I'm in Nigeria and I happen to be part of the team, I'll be giving example based on what we've achieved so far. Because sometimes we get tempted to say nothing has been done by the country, but we have achieved a lot. And I think at the state level too, or the subnational level or the regional level, they are also reinforcing or supporting One Health activities, which is very key. And it's very important for us looking at Nigeria as a whole. If you look at the 3 tiers of government, we have the federal, the state, and the local government. Wherever you are, there's a local government. And in that local government, there's also electoral wards. So once we cascade this One Health structure down to the ward level, it's very easy to implement because that's where you can actually engage the people based on the challenges at hand. And even if there's a future pandemic that is coming up, we'll be able to surmount that to achieve our goal. So basically that's that. So One Health in practice, looking at still for our document for the One Health Strategic Action Plan for Nigeria, on the list they agreed on certain priority zoonotic diseases, and we have about 10 of them, and I think it's being reviewed. So rabies is at the top, avian influenza, Ebola, swine influenza, anthrax, tuberculosis, African trypanosomiasis, Lassa fever, E. coli, brucellosis. So you see, these are actually what the priority diseases we have in our own national action plan, One Health strategic plan in Nigeria. But then looking at the One Health across the sector. So if you want to achieve zoonotic disease control, if there's no communication between the human health, between the animal health, between the environmental health and other relevant stakeholders like people in the media, like people in the security operatives, there's no way you will achieve that. One thing I'm happy about the Nigerian One Health system is that it's not only the 3 sectors that are involved. I've attended meetings where you see the Department of State Security Service are represented, the quarantine services are there, civil defense are there, the Nigerian police are there, and the lawyers too, because some of them have legal implications, some of the activities. So with the involvement of these stakeholders, so it means there's communication across the sector, which is very key. When you talk about antimicrobial resistance, misuse of antibiotics in humans, misuse of antibiotics in animals, there's going to be environmental contamination once you discharge these antimicrobials into the environment. So what happens then? There's sustainability of AMR, you get. So, but when these sectors are working together, we'll know how to manage, create awareness, we'll do advocacy on responsible use of antibiotics. And can you talk about food safety? You can't talk about food safety, food security without looking at the 3 sectors. I keep telling people, when you talk about food security, when you're talking about livestock productivity, you can't talk about these issues without looking at health. If people are not healthy, if the animals are not healthy, you forget about anything food security. So we need to have a food secure society. We need to have a robust One Health sector that is communicating, that has an effective communication mechanism. So the environmental health system also, and emergency responses. So to achieve all this, there must be that synergy and there's communication across board. Thank you. Then, so why One Health fails without communication? Most times the reason why we are not achieving what we intend to achieve is because first thing is we have sectoral silos. People are working independent of each other. We don't share data, we don't share information. So let me give you an example. Recently, there's an outbreak of Lassa fever in Nigeria. So imagine now, we know it's been transmitted by the mastomys rodent. So imagine it's just the human health sector that are just working without the animal or the environmental health sector. We cannot achieve anything. So that's why if you look at even on the priority list of diseases, those diseases, zoonotic diseases, are actually what the country agreed upon. There are other zoonotic diseases of importance, like brucellosis, leptospirosis, that are causing infection, that are killing even humans and animals as well. But at that level, I still feel we have not been, there's no strong communication, but then we are getting to it gradually. So people are working, when you work in silos, you work independently, you don't communicate to one another. There is no way we'll achieve that change we want. We can come here, spend 2 hours, 3 hours, 2 days, 3 days without communication, without collaboration. There's nothing that can be achieved. Then poor information sharing. Information should be shared as and when due. In fact, I'm even thinking our own disease reporting platforms should even have, we should have a single, all the 3 sectors should have access to their disease reporting platforms. The IDSR for NADIS for us in the human health sector, in the animal health sector. So once you have access to this, if there's a disease happening or disease occurring event, disease event is happening here, all stakeholders that are responsible should be notified, share information. Because most times, if it's a human disease, let's say the veterinarians don't know much about the disease or the environmentalists, the human medics should share information that will help guide the implementation of strategy towards cope that disease. Then community exclusion, whatever we are, even this conversation we're having, even everything about One Health is all about public safety and public health. So if you come in and sit down, we blow grammar, we talk to ourselves without looking at, okay, this, I hope maybe for the presenters, if you've not planned, maybe at the end of this conference, 2 days conference, maybe you should have a communique, what you have as a communique going forward, what you intend to achieve as a group. So community, it's important to involve the community in everything you're doing. First, you do advocacy, you do community mobilization, you go and meet the community gatekeepers. You compartmentalize your key messages and you give them the information. Before you know it, any activity you want to implement can be achieved. Then weak policy translation. Yes, we know this sometimes we don't have proper control over because it's government mostly. But then with proper advocacy to people in government, and I think we can achieve that. Because most times we think our leaders or political leaders, we feel that they don't care, but they actually care because they are also part of the community and they are also affected in the way. When COVID happened, everybody was affected. So most times the reason why One Health normally fails is because there's no proper communication. We work as independent, or rather instead of working together. So what do we mean by communication? No, communication is sharing of information, listening, building trust, and influencing behavior. More than you mobilize for action. Because you communicate to people because you want them to either pass the information on. Why are you passing that information? It's either you want to change behavior, it's either we want to notify people to take certain decisions or action. This is why we communicate. Without proper communication, we are not going anywhere and we are not going to make headways. Are we together, please?
Yes, sir.
Yeah.
Yes, sir.
And communication. Okay. And communication is actually a two-way thing. You can't just communicate to people without getting feedback. You need feedback because the feedback is important for you to implement changes or to make changes in the information you are passing. As for us, for the research institute, for those in the academia, so everything about science that you are doing, you just publish and go without having proper impact on policy. For example, I want to carry out a research. My research should be tailored to the national priority diseases, either in humans or animals. It has to be tailored because what are you trying to do? You're trying to solve national issues. So there should be proper alignment between science and also policy making. Remember during COVID, there was a lot of back and forth conspiracy theories. It's because most of the informations are not backed by empirical evidence. If there's empirical evidence, it's even going to make it easier for the policymakers to come up with policies that will be implemented. There should be a link also between the veterinary and the public health, between the government and the community, and also for every empirical evidence that you have, there should be what action that should be taken to cause what change. That's why it's very important. Communication is serving as a bridge, and that bridge is two-way. Once you are given the information, you should wait for feedback, and that feedback is key. Generally, we don't, I wouldn't say the human race, generally feedback is not nice. but then feedback is key. The whole idea of feedback is for you to improve, which is very important. If you don't want to improve, then forget it. So we need that. Then power of communication in One Health. So first, it builds shared understanding. It helps to strengthen trust. It encourages joint ownership and drive collective decision. That is why I said I was trying to ask at the end of this conference that you have, when you have a communique on One Health, on the next steps. So here on this, I don't know the demographic of the participant, but I know we are many. That 1,000, I know we are coming from different sectors, from different disciplines. Now that joint ownership is key. Anybody, wherever they are, whichever country they come from, once they see this communique, they see this next step, they know, okay, I was part of the team that came up with this. So you see, there's this ownership of the activities or the plan. But once you keep quiet, once maybe few of you decided to sit down, okay, let me go up with something without considering the other sectors, then the other parties will be feeling, oh, I'm not part of this, so why should I even pick interest in this? So that is why we should build shared understanding. People need to understand the key messages, build trust. When you need to earn trust in communication, encourage joint ownership, and also derives collective decision. Because once there's ownership, any decision you are taking is binding on everybody. So that's why, most especially if you look at when it comes to health outcomes or health situations or events, the mostly we implement that at the community level. If the community don't have their own buy-in in such plans, at the end of the day, you come to the field and you waste your time, you waste your resources. But if there is a community buy-in, that is why whenever you go for advocacy and community mobilization, let the people be part of all the activities you are taking. And then, so this is just an example. So from information to action. So information alone does not guarantee a change of behavior. People have been hearing information, but they may not change their behavior. So just for the fact that you presented the information is not an automatic guarantee that is going to change their behavior. So information has to do with facts, data, messages, awareness, campaigns, lectures, and media reports. These are sources of information. For example, when we say Lassa fever is transmitted by mastomys rats, you get this is just an information. To the layman in the village, to the layman in the countryside, to people who are not technical, what is mastomys rats? You need to break it down to start explaining to them, okay, multi-mammoth rats, probably those rats that have multiple mammary glands, or you tell them breast. Use things they can actually relate to. So another key thing from information to action is understanding. You've passed the information. If the people did not understand, there's no understanding across the sector. It's a problem. So without understanding, information becomes a noise. As far as we're concerned, the people are concerned, as far as sector is concerned, you just pass an information, you've just spoken, they've heard your voice, but nothing happened, nothing changed. So process the information, connect it to their reality, and let them know the why and the how. You tell them Lassa fever is transmitted by mastomys rats. This is how it's been transmitted, right? And also connect it to their own reality. How do they get affected? So you have to look at in the setting, and all settings are not the same. So you can have a generic information, but then any sub-community you go to, you should try as much as possible to simplify it based on what is common there. For example, messages you can give, like mastomys rat contaminate your food. If there's poor food storage, increases the risk of getting infected. Proper storage reduces the infection. Now you see, you are telling them the why, the how, and also how they can prevent themselves. So basically, that's why information is key. Then trust. No trust, no behavioral uptake. People need to act. They need to believe the message you are carrying. And once they don't trust you, whatever you're saying, they will believe, you're coming with a different kind of narration to maybe to swindle them or to do things that may not be palatable. So they need to perceive the message as credible. So that's why you need to build that trust. And they should, like I said, no singular setting is the same. So you need to understand the culture and the behavior of the people in the community you are going through. Then commitment. The next thing is commitment. Commitment bridges intention and behavior. So once they trust you, the next thing is they start these people that you're trying to implement strategies to, they start taking responsibility. They'll begin to act and they feel motivated to act. So, for example, I'll start storing my feed in metal containers because they know that contaminated feed has chances of there are risks if their feed food sources are not properly stored. There are risks of becoming infected with Lassa fever. I'm just giving an example with Lassa fever. So you see, people will start taking action based on the trust. Then for action is the only storage stage that changes the outcome. So just because you pass the information, there may not be change of behavior. So this is measurable. So you see the people who start proper feed storage, they will improve their farm biosecurity. Then they'll start reporting if there's a disease event that they don't know. And also for those in the animal, if they're dealing with animals, they'll start vaccinating the animals, or they'll start going to the human hospital to report cases of outbreak. Are we together, please?
Yes, please, we are.
So looking at
together.
Yes, sir.
Yeah, thank you. So looking at rabies as a form of another example. Now you see, rabies is 100% preventable through vaccination. Once you vaccinate the dogs, you can prevent that. But then up till today, we still keep having issues of rabies cases. In fact, where I work here, University of Jos, I think on Sunday we had a case of human rabies. In fact, the patient had already started showing symptoms of rabies. So despite the years of anti-rabies campaign in animals that we've been doing, but still the disease keeps persisting, right? But the problem is, that's why community education is key. You know, once you educate the community, once there's proper public enlightenment, because there's this local saying that no disease in Africa, but is that true? No, there's disease in Africa. So proper education is going to help reduce drastically the impact of rabies. For example, if you look at in the human health sector, I think one of the ways Nigeria was able to be declared polio-free was one of the key strengths they had then was through proper risk communication. Almost all the stakeholders were involved and they achieved that. The risk communication was superb. So, and there's need for multi-sectoral collaboration because the human health, animal health, and also the environmental health needs to have that proper conversations among themselves regarding rabies. And once you have a proper community awareness and there's multi-sectoral collaboration, the next thing you know, there's going to be increased vaccination uptake, whether it's pre-exposure of prophylaxis or vaccination of animals and pets. Then, and also there's going to be reduced human death. These are the outcomes. But until and unless you have that proper communication, we are not going to achieve that. For example, in the case of antimicrobial resistance, human misuse, animal misuse, there's also environmental contamination. So we need to talk to ourselves. We need to have that sectoral collaboration to be able to achieve the menace. I just gave these two examples to show us how effective One Health collaboration can solve some of our major health problems and even the minor ones. So who must communicate? Who are those people that should be involved in the communication? So health professionals, veterinarians, environmental experts, policymakers, media, and the communities. To me, among these key things, the communities are important. You can come up, all of us, I believe, most of us, since we are talking of One Health, we have human medical doctors, veterinarians, environmental experts, those people in the ICT, and in a way, we are all technical people, we are all professionals. So you come with beautiful ideas, beautiful flyers, beautiful jingles, but without looking at the community, looking at the community gatekeepers, we may not achieve meaningful things. The community need to be involved in communicating amongst themselves. You need to bring out those barriers. For example, you go to the field as a medical doctor or a veterinarian, you're wearing your lab coat, you come and meet the people in the community and you say you're a doctor, so and so and so. The first thing they do is they'll put a wall because you were already coming from that professional perspective. So that is why the community is very, very key in what achieving effective One Health communication. And that is why for us I believe it's also the same thing in the medical cycle. When you're doing a case definition for a disease, there's also a community case definition because there's a way the community understand that particular disease, whether in animals or humans, as the case may be. So the community to me here is the most important component because all these people are still focused on the community. So what are the barriers to effective communication? Technical languages. So for example, I'll come here and start talking to you about the biology of Lassa fever. You get. So, and I'll start telling you about the scientific name. I'll start talking to you about the capsid, the what. These are all technical terms. You need to simplify the message to the language that, in a way that they will understand first. And if it's possible, you can even translate it to their own language, simplifying the technical language to them, because that's the whole idea of communication. You can come blow grammar and the people will just be looking at you. So you need to understand your audience. Then professional silos, as much as possible, we should try and break down this professional rivalry. We are working towards a common goal. And what that common goal is to see that what the One Health systems in Nigeria or in Africa are working effectively. Power imbalance. For example, let's say the human health or the animal health sector will be having that superiority complex on the environmental health sector. You see, we should be operating at the same level, even though I know among the three sectors, the human health has advanced because even globally it has advanced above the animal health and also the environmental health. But we need to operate at the same level because even in terms of funding, we don't operate at the same level. When it comes to One Health, we should start speaking to ourselves at the same level. Then power of poor media engagement. That is why the media people are very, very effective. You see, I believe this flyer, one of the key reasons I must say you guys had this large participation is the power of media engagement. Whether it's electronic, whether it's flyers and all, you use your social media handles properly and people actually keep. That is the in down for us. If you remember, for those in Nigeria, the lady that was bitten by a snake and died, may God rest her soul. I think the thing trended within first, 6 or 7 hours. It has trended all over Nigeria. So you see, that's the power of media. So let's utilize the resources we have, most especially the media, the social media platforms we have, to see that there's going to be effective communication of our health messages, as the case may be. And sometimes for most of us in Africa, because we happen to come from resource-limited settings, we tend to think there are areas where people don't have networks or don't have smartphones. But I tend to disagree sometimes because there are communities you go, there are young people there who have smartphones. In fact, some of my students are coming from such communities, so you can't tell they don't have smartphones or they are not ICT compliant. So that's why it's very important for us to utilize that. So poor media engagement is one of the barriers to effective communication. So how do we make One Health communication effective? We should use simple language and we should tailor our key messages based on the uniqueness of the audience or the community. It's very, very key. And you should institute community engagement early. You need to carry out your advocacy before community mobilization. So once you do that very early, it's very easy to pass in your message. And you should also encourage feedback, because once they are part of the communication process, they tell you, okay, this is, we feel you, if, for example, design a flyer or a fact sheet with some pictures and you brought to the community, you should be able to get feedback, from the community. Okay, how do we feel about the flyer? Is the information really clear to understand, because even in the different communities you are going to, the knowledge of people differ. So you have people at different level of understanding. So there's need to encourage feedback, because the whole idea is you want to improve. Then what is the role of youths and students and also young policymakers as we are? First is advocacy. Advocacy is, you can do advocacy to national, state or local level government, and also advocacy to even private sector, because we cannot achieve what we want to do. Government alone cannot do. So the private sector needs to be involved. The youth and the student or the young policymakers that we have here, you need to engage the private sector, the banking sector, because that's where the funding is coming. And once you communicate what you want to achieve and they see the need, they will key in and they will support that. And social media engagement, you should engage strongly to the people, either through electronic, radio, TV, as the case may be. Whatever is available to try and utilize it. Community outreach is good. That's why the fact we have phones, smartphones, we have radios, we have TV. But one-on-one engagement with people, once they see you in the community, you play with the children, you play with the elderly, you bring music around, people feel that you are part of them. So once you're passing the message, they understand better. And then it's research translation. So for those of you that actually in the academia and also in the research institute, so whatever you are doing, whatever research you are carrying out, it should actually be able to solve issues around. You should communicate back to the people you are collecting samples from or you're trying to research. I will maybe want to encourage the planners of this event. At the end of the day, if you can have a small kind of paper on the implementation of this conference, you just have a paper, if you can publish it in some of your platform or on your website. This is how you came up with this idea, how it was implemented, the feedback, so that maybe there's an organization or there's a funding agency tomorrow that will be out there to support your initiative. So once they see the processes involved in this, they can actually go out and support you. So what are the key take-home messages? One Health is all about connection, is all about collaboration and coordination. So communication also derives what collaboration, and collective action starts with what understanding. Understanding alone does not change behavior, but once there's understanding of the information that is shared, there's going to be what collective action. So call to action. So we should learn to break the silos, avoid professional rivalries, communicate across sectors. There's need for proper communication across all the sectors that are involved in One Health communication, and also engage the community and also act collectively, because it's all about collaboration and coordination. So thank you for listening.
All right. Thank you so much, Dr. A.A. Bitrus, for that wonderful and insightful session. It was truly eye-opening and very, very interactive, and I hope we all learned some of the ways we can implement One Health. So I'll be opening the floor for questions and answers now. If you have any question, you can indicate on the chat box, then I will address it to Dr. A.A. Bitrus. Thank you so much. So we just have 5 minutes for the question before we move over to the next session. Please, you can type your question on the chat box. Okay, while we are waiting for the questions, you can kindly turn on your, okay, we have one question here. Okay, let me take the question. What are the major challenges to implement One Health approach? That question is to you, Dr. Vitros. Then the second question, please, for a researcher working on cancer genomic, for instance, prostate cancer, how could we integrate the One Health approach to manage that cancer? All right, these two questions are directed to you, Dr. Vitros. The floor is yours.
Okay. Can you please read the first question for me, please? I'm trying to get a pen and paper to submit. What are the challenges of?
Okay, the first question. What are the major challenges to implement One Health approach?
Okay. Then the second question is on prostate cancer.
Yes, sir.
Okay. So how can they use One Health, right? What are the major challenges? So the major challenges to implementation of One Health. So this is country and also location specific. We cannot say, even for example, in Nigeria, where all the states are at the same level of preparedness or understanding of the One Health concept. So to me, it's going to be different when it comes to location by location or state by state or people by the community. So the major challenge is this. We talk about for those of us, let me give Nigeria as an example. Up till today, if we are going to tell ourselves the truth, yes, we have One Health, yes, we want to do One Health, but the communication is not really like proper. For example, there are so many states that have not implemented the One Health technical working group to be having like the medics, the environmental specialists, and also the veterinarians. So that's also a challenge, and that's also a barrier to implementation. And sometimes lack of funding is a major issue we have. Most times we come here, we talk about One Health, but I don't think there's budgetary allocation to issues around One Health. We are still struggling, and that was why I said in our advocacy, let's reach out to private sector, let's reach out to other potential donors and partners. And also another thing would be sometimes you will have government or bureaucracies or lack of political will. Because at the end of the day, you cannot implement anything in any community, in any locality without the involvement of the government, whether the state, the federal, or the local level, or the traditional institution. So this could be some of the challenges you will have. That was why I said is context specific or kind of location specific. You need to understand the location first, the community, and then before you implement the activity, you must have done your studies first to look at what are the gaps. How do I implement these challenges in this community? You can even do a pilot study to see what are the possible challenges you may encounter in the field. So once you do these things, I think you can have at least, let's say, 70 to 80% chance of success. So which is key to me. Then the person working on prostate cancer, I think, so how do you use One Health to implement prevention? So basically, I'm not sure whether there are known animal or definitely cancer has environmental risk factors. I'm not sure of the animal side. So, but then all diseases have risk factors that predisposes to such diseases. So since you are dealing with humans and more or less you're focusing on the genomic aspect, you're looking at the cancer cells, trying to study the cell at the cellular level or the molecular level. So to me, what I feel you should do is to try and link up those cancer patients that you have. Maybe you can have like a questionnaire to ask them to look at where they are coming from. You look at the profile of the soil in that environment, the water in that environment, the type of food in that environment. You may be able to link up the environmental the environmental factor, and your cancer studies. And of course, you can also look at, maybe just if you want to go a bit wilder, you look at these people that have, let's say, this prostate cancer, the different age groups or the different age categories. Do they have contact with animals? And if they do, what type of animals? You get, so probably you may be able to establish, okay, maybe there's this linkage between these three. And the environmental factor I know is there. So, and even when you are carrying, so once you come up with the findings of this study, it's good to share it back with the community and see how it works. I hope I was able to answer the two questions. If not, maybe I can still expatiate more on it. Thank you. Over and out.
And summit, it will be addressed. So right now, I encourage every one of us to turn on our camera. Let's take a quick shot before we move over to the next session. So please, can we turn on our camera? Okay, I'm coming. I'm still yet to see some of you. Please kindly turn on your camera so that we can take a shot of this session. All right, the moderators, from your end, you can, if you are able to capture the faces of the participants, you can kindly snap or screenshots from your end, because I am not seeing it right here now. Thank you very much. So I think we are done with the photo session. Thank you so much, Dr. Bitros, for a very wonderful and insightful session that you have delivered this wonderful evening. We are very, very grateful for sharing your insights and wealth of experience to enlighten us on One Health. Thank you so much, sir. It's an honor to have you. So moving on, I'll be handing over to my lead moderator to continue this session. Over to you, Ms. Bright.
Thank you very much, Mr. Jeffrey, for that wonderful session. And thank you very much to our speaker. It was indeed very educational, and I'm sure every one of us has heard and learned a lot today. Learned about ways that we can use communication to take One Health further. We are going to be stepping into the next session, where we're talking on AMR, African Youth Leading Charge in Antimicrobial Stewardship. And we'll be having Miss Emanuela for that session. She'll be moderating it. Miss Emanuela, please, the floor is yours.
Thank you very much, Miss Bright. Actually, my name is Eniola Akinola. Good evening, everyone. Good day, everyone. Like I said earlier, my name is Eniola Akinola, and I'll be introducing Dr. Nancy to take the next session, which is themed Strengthening One Health Through Youth Engagement in Antimicrobial Stewardship. I'd like to read a bio to us now. Biography of Dr. Ifeoma Nancy Inzelu. Dr. Ifeoma Nancy Inzelu is a public health veterinarian, lecturer and researcher at Joseph Sawantaka Makurdi, Jostum in Nigeria. She currently serves as a departmental examination officer for the Veterinary Public Health and Preventive Medicine Department, as well as the seminar coordinator for the College of Veterinary Medicine in Jostum. Dr. Inzelu supervises both postgraduate and undergraduate research. Her research is focused on parasitic zoonosis, One Health, food safety, and neglected tropical diseases. She is passionate about community health promotion. Dr. Inzelu has a developing interest in artificial intelligence and digital health. She was recently selected as a cohort participant in International Center for Artificial Intelligence Research and Ethics Women Elevate Program, an innovative effort aimed at empowering 5,000 women through Microsoft AI training. Dr. Inzelu earned her tertiary academic degrees from the prestigious Ahmadu Bello University, Zaria, Nigeria. She is a member of the Nigeria Veterinary Medical Association. Dr. Inzelu has received many awards, including a Commonwealth Scholarship at the Royal Veterinary College in London, a Biology Week outreach and engagement grant from the Royal Society of Biology, and many others. She has multiple peer-reviewed articles and has participated in both local and international conferences. She is more known by her middle name Nancy among her peers and acquaintances. Dr. Inzelu is married with 3 children. In her spare time, she enjoys watching films, listening to music, and spending time with her friends and family. Ladies and gentlemen, I present to you Dr. Nancy Inzelu. Dr. Nancy, it's nice to have you here with us today. You have the floor.
You are muted, ma. Hello, ma, you are muted.
Okay, thank you. Sorry for that. Yes, so hello, everyone. Once again, good day, good morning, good evening, for wherever you are joining from. I am delighted to be here, to be part of the One Health, the maiden edition of the One Health Summit Africa 1.0. It's been days of preparation, and we are here. I'm a public health veterinarian, and I work with the Joseph Sawantaka University, where I'm, by the grace of God, a lecturer and a researcher in the Department of Veterinary Public Health and Preventive Medicine. Before going on, I want to say I want to greet my trainer, Dr. Bitrus Asinamai. He trained us during the ISAVET program last year. So I am happy to see you here, sir. And your presentation was very impactful. So without wasting much time, I would want to delve into the topic of discussion. Can you hear me very clearly?
Yes, ma'am.
Yes.
Okay, thank you. So I would share my slide now. Okay, and please, you will pardon me because of the streaming ability around where I am right now. I will have to remove my video so that I will maintain the quality of the virtual seminar. Thank you. Can you still see my slides? Can you see my slides?
Yeah, we can see you.
Yes, I can see.
Hello?
Yes,
You can see it clear. Okay,
Yes,
thank you.
it's clear.
All right, thank you for that. So today I'll be discussing on the topic strengthening One Health through youth engagement in antimicrobial stewardship. The outline for my presentation today will take this form. An introductory section will discuss about the burden of AMR, why youth engagement matters in antimicrobial stewardship. What are the pathways for youth involvement in AMS? The examples of youth-led initiative in the African region. What are those challenges and barriers that affect the involvement of youth in AMS? And what are the strategies to strengthen youth engagement? And a call to action. The first presenter has explained to us in very good detail what One Health is. So as a way of introduction, we're going to define these terms. What is One Health? What is antimicrobial resistance? What is antimicrobial stewardship? So just briefly again, One Health is an integrated unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystem. This has been made very clear to us. It's an intersection between animal, human, and environmental health. At the very core in the intersect there is One Health. Whatever it is we do, what is those things we do that affect our animal health, that affect the ecosystem, that affect human. That is One Health, an approach we're using to solve this problem. Now, what do we know or understand by antimicrobial resistance? AMR occurs when microorganisms, that is, we're talking about bacteria, viruses, fungi, parasites, change over time and no longer respond to medicine, making infections harder to treat and increasing the risks of disease spread, and also increasing the severity of illness and death in some situations. AMR makes other medical procedures and treatment like cesarean section, surgery, chemotherapy much riskier because the drugs that are expected to work are not working because these secondary bacterial infections or the bacterial infections that would have come up during these procedures, these organisms have developed resistance against this medication and therefore they will not work, and then the situation becomes riskier. Okay, so AMR is one of those pressing public health threats globally, affecting both human and animal. A study carried out by antimicrobial resistant collaborators in 2024 has shown that it is linked to more than 1 million disease-related deaths in Africa and 700 deaths per year globally. This is huge. Now, in addition to death and disability, AMR also has significant economic costs. By 2050, it has been projected that AMR would cause significant global economic damage, with estimates suggesting a total of up to $100 trillion and between 1 to 3.4 trillion US dollars GDP losses per year by 2030. That is a huge problem we have at hand. Now, let us look at it at the global level. What is the global burden of AMR? In 1929, it was estimated that bacterial AMR directly caused 1.27 million deaths worldwide and was associated with nearly 5 million deaths. By 2025, the figures reached 1.14 direct deaths attributable to AMR and 4.71 million associated deaths, forecasting and predicting that by 2050, we would have about 1.19 million direct deaths as a result of antimicrobial resistance and about 8.22 million associated deaths. Now, these numbers are very huge. It's very scary. Looking at the African horizon, the African CDC has warned that antimicrobial resistance is becoming a greater threat to Africa than HIV and AIDS, TB, and malaria combined, and that children and vulnerable population were at the highest risks. During a press conference in 2024, the Director General of Africa CDC disclosed that the growing crisis of AMR could require an estimated $2 billion to $6 billion annually to address the deadly impact of AMR on the African continent. This is a huge sum of money that should be directed to reduce hunger, to provide good quality water, to ensure food security in the African continent. If no intervention is being instituted or if nothing is done about this money will be channeled to address the deadly impact of AMR. So apart from death, disability, it has a huge economic cost in the continent and globally. Now, it leads us to the other word. What is antimicrobial stewardship? Antimicrobial stewardship is an organizational or system-wide healthcare strategy which is meant to promote appropriate and responsible use of antimicrobials through the implementation of evidence-based intervention. Antimicrobial stewardship is a systemic approach also used to educate and support healthcare professionals to follow evidence-based guidelines. The key word is evidence-based guidelines for prescribing and administering antimicrobials. Now, our health workforce, they are very of crucial importance because these are the front liners in safeguarding the effectiveness of antimicrobial medicine. So they need to be aware, they need to have the reciprocal knowledge, they need to be involved in antimicrobial stewardship so that our medicines can be, the medicines we have now can be kept active, would work active and not become, organisms will not become resistant to them. All right, then we then move to conceptualizing youth engagement in antimicrobial stewardship. The first speaker has talked about the role of communication, how we communicate, how communication is important in One Health. In Africa and in African health advocacy, youth engagement means that people aged 15 to 35 are actively involved in making decisions. It moves away from just receiving medical information to them working together, collaborating to carry out antimicrobial stewardship programs. This change requires moving away from just giving young people a say without real power, because this happens in Africa, where there is lack of strong leadership support and proper funding for health projects led by youth. So to ensure that participation transcends beyond the mere symbolism, that is youth just being involved. Okay, they say youth has to be involved and then we involve the youth without really giving them the power, without empowering them. Stakeholders must adopt transformative frameworks that address systemic inequalities and empower young Africans to influence socio-economic determinants. Warinjo et al. In 2025 came up with a beautiful practical framework for meaningful youth engagement in AMR responses. The building blocks of this framework included structural integration, that is integrating youths into policy making, then equitable access to funding. The first speaker talked about that usually you see that no funds are there for these projects. So there should be access to funding. There should be capacity building of the youth, bi-directional. The younger, the youths being working together with established professionals, increasing their knowledge, improving their knowledge on how this risks of AMR is reduced. Then one of the building blocks again is robust accountability mechanism, and then intergenerational collaboration. Again, institutional support and sustainability is very important. Not just one-off campaigns. Yes, we have this engagement, but it should be sustainable. It should be sustained, periodic, so that the message still remains fresh in our minds. So it's a very beautiful paper that is out there in the public. which will be nice for one to read and digest. Now, the pictures you're seeing on the slide are various youth engagements in regards to AMR risk communication, which was carried out by One Health and Eco-Sustainability Initiative, OHESI, which is one of the partners of organizing partners of this program. The message, they didn't just leave the message with themselves. They went out to the streets, they've been to the streets, to secondary school, to the market, to the park. They have carried out various awareness programs about AMR, letting the communities, letting the people know the risks involved. There is a problem, why there is a need for attitudinal changes. And a lot of these initiatives are out there, being carried out by a lot of organizations. We'll see that later. Now, the question is, why is youth engagement important in antimicrobial stewardship? Why should we involve the youths? Now, the active involvement of young people in antimicrobial stewardship in Africa is crucial for several reasons. One is their significant demographic presence. They represent 70% of the population. We compare the population to the very young and to the old, they have a huge population. That advantage needs to be harnessed. Two, their role as future leaders and healthcare professionals. So, because they are future leaders and healthcare professionals, they need to gain the requisite knowledge, the skill, the right information, and how this AMR need to be, the risks need to be reduced. What policy interventions can come in? They need to be educated. They need to be engaged. Then their capacity to act as catalysts for behavioral change within the communities. You can believe with me, in your various communities, you see youth doing things. People call it doings. So if you use them, use their energy, use their time, we can actually achieve behavioral change within our communities. So this demographic advantage, coupled with the inherent adaptability to new information, positions them uniquely to address the prevalent challenge of antimicrobial resistance. The youth can play a vital role in bridging that knowledge gap concerning responsible antibiotic use and the broader implication of antimicrobial resistance. The youths are energetic, they are creative, they are innovative, and they are digitally connected. The last speaker talked about the role of social media in communication. You know, within few hours, seconds, information is everywhere. It goes what? Viral. And so if this medium is used, we see that information will reach the people very fast. And even in the rural areas, you will agree with me that people spend most time with their phones, watching skits, watching videos or educational videos, than compared to staying in front of the TV and watching any video. Because that thing they can watch on the TV, they watch it within seconds on their phones. So it's a medium that should be used to reach out to the communities about antimicrobial resistance. So harnessing all these advantages, the creativity of the youth, is important to design new solutions, using digital forms to spread awareness, and then driving grassroots change in communities where cultural practices encourage misuse of antibiotics. Simply put, youth are not just the beneficiaries of One Health, they are its champions. Youth are the champions of One Health. Now, the question goes to, what are the pathways for youth involvement in antimicrobial stewardship? We have agreed that there's a problem. We have also seen the magnitude of the problem. We have also seen why youth should be engaged in antimicrobial stewardship. Then the next question is, how can the youth be engaged in antimicrobial stewardship? One is in the area of education and awareness. Youth-led campaigns in schools, universities, and communities are very important to demystify antibiotics and promote antibiotic use. Using this means peer-to-peer campaigns, you see, this message will get out there to the communities, to the schools, to the market, in our rural communities, where we have that patent medicine store guy that dishes out medicine to any individual that comes complaining of headache, fever, and the rest. The patent medicine practitioner mixes up concoctions of antibiotics gives to the individual. The person takes it for day 1, day 2, day 3, and he feels better. And then that's it. You see, the cost of that antibiotics administration was not followed through. There is abuse there and there's misuse. So a lot of this happens. So the education, the awareness is very important to get to the grassroots. Another pathway is research and innovation. Student-led projects should be encouraged to explore alternatives to antibiotics. A lot of this has been happening. There is one going on in my uni right now, and I know there was a study like that got a grant in Uni where alternatives to antibiotics are being explored, like probiotics, like vaccines, and also creating awareness of improved hygiene practices. Because if this are done, it will reduce the risks of disease or infection. Then community advocacy, we talked about that peer-to-peer influence is very powerful. The youth can change self-medication practices and promote hand hygiene. Another pathway is policy participation. Youth voices must be included in AMR task forces, health councils, and national action plan. I am very happy that this is ongoing, and I know in other countries, I want to believe that that leaf is being borrowed. That leads us to examples of youth-led initiative in antimicrobial stewardship. One of such is the Students Against Superbugs Africa, South Africa. They implemented an AMR ambassador program in 14 countries, creating school clubs and engaging over 30,000 youths. And South Africa is a youth-driven initiative which sought to mitigate the threat of AMR in African communities using a One Health approach. They do this by empowering young people throughout Africa to be lead advocates in the fight against AMR. Another initiative is the React Africa Youth Engagement. It drives the African Youth AMR Alliance Task Force and the AMR Leadership Program, empowering students with skills to lead advocacy and awareness, including the World Antimicrobial Awareness Week campaigns. Another important group is the One Health Development Initiative, which the founder gave us an opening remark here. The initiative runs the Youth for AMR Risk Communication and Action, educating communities, including school-level initiatives in Nigeria. The goal of the project is to empower the next generation of AMR advocates and antimicrobial stewards through comprehensive training on risk communication and community engagement. Another very important one is the One Health Eco-Sustainability Initiative, OHESI, which is one of the co-partners of this summit. Formerly, it was known as Benue One Health Network. Dr. Jacob Ondu, I call him Ondu, Dr. Ondu Jacob, happened to be one of our ex-students in Justin. So I saw him not grow up now, with his interest in community development growing each day. Now, OHESI is a non-profit organization committed to advancing the health and well-being of human, animals, and the environment through integrated, sustainable, and collaborative approaches. Now, what guides it is the One Health framework. It uses it to address complex global health challenges through youth empowerment, educations, webinars, seminars, advocacy, and community-driven action. They've carried out a lot of projects. Among these projects, they led several awareness campaigns and webinars on antimicrobial resistance, impacting over 20,000 individuals and promoting responsible antimicrobial use. There are a lot of this initiative, and I'm happy that more and more is gaining ground. We have others like the African Youth for AMR Communication, led by Stop Superbug Squad. Then we have this Level Up Biosecurity Lockout AMR campaign led by the BioShared Squad. Then we have the Rollback Antimicrobial Resistance Initiative in Tanzania. We have the AMR Guidance in Kenya. And we have the Alliance Against Antimicrobial Resistance. They conduct local targeted outreach to improve the understanding of AMR. A lot of this. All these initiatives shows that young voices can shape global health policies. Okay, and then when youth are empowered, they deliver impact. So youth need to be empowered, they need to be engaged in antimicrobial stewardship. This leads us to the challenges and barriers in Africa for youth engagement in antimicrobial stewardship. By challenges and barriers, I mean, what are those difficulties or obstacles that makes it hard for youth to actively participate in antimicrobial stewardship or systemic or structural issues? One of them is knowledge and awareness gap. Across Africa, AMR is often not adequately addressed in school and university curriculum. They are not there. It's not integrated in the curriculum. So there is need for that. Also, gender disparity can limit access to information, with young women sometimes having fewer opportunities to engage in AMR education. So that could be a factor. Then we have limited representation in governance. One other barrier is limited representation in governance. Youth voices are often excluded from policy-making spaces where AMR strategies are designed. The national AMR action plans in many African countries are developed with minimal youth consultation, leaving them as bystanders rather than co-creator, as stated or as indicated by Burundi et al. 2025 in his paper. Another factor is insufficient resources and support. The funding is usually not there. It's usually not there to back youth-led projects. There is lack of funding, there's lack of mentorship, institutional backing. So it's a serious problem that needs to be tackled. Then we have socio-cultural barriers in the sense of self-medication. People are used to self-medication. When they are sick, they just move, instead of visiting the hospital, they move to the nearest chemist shop or a patent medicine shop to get over-the-counter drugs to take. Then in livestock and agriculture, antimicrobials are often used for growth promotion without veterinary oversight. So these practices are rooted in our culture and economics, making youth advocacy more challenging. Then we also have systemic and structural issues. That is weak enforcement of regulation on antibiotic use in both human and animal health. I had an experience when I was in the UK. I was pregnant and studying for my PhD in the UK. I got flu. I was coughing. I had all signs of flu. I went to the hospital. As somebody who is in an area, in a country where I can easily get access to antibiotics, I thought it was going to be the same thing over there. The antibiotics was not given to me. I complained they should give me antibiotics. They didn't give me antibiotics. Instead, they asked me to take a lot of rest. I should drink warm fluid. I should rest. I will feel better. 1 week, I'm still coughing. Even before the 1 week, I went back that I'm not getting better. But following their protocols, this is a system where things work. Following their protocols, their enforcement and everything, the doctor saw that antibiotics was not indicated. I went back, I had no choice. But after 2 weeks, getting to 2 weeks, the situation was not resolving. At that time, I was already producing thick, yellowish sputum. So in order to show as evidence, I had to snap the sputum out, and I had to snap it the way it was thick, yellow and thick, so that I'll have something to show the doctor that, see, this is what is happening, so they can give me antibiotics. So it was when I went back that it was not resolved, the situation was not resolving, and I showed him that he now considered it that after 2 weeks, the situation has not resolved. That was when they gave me antibiotics. I can tell you that those antibiotics, they counted it for just 5 days. They counted it, nothing less, nothing more, to make sure that I did not take an overdose. I didn't take more than I needed or less than I needed. Now, this is a system where there is strong legislation, where there is strong enforcement. Such should be done in the African continent. Now, these are challenges, but as we see them as challenges, it can be seen as opportunities in disguise. These challenges highlight where youth energy must be directed. All right. So we now move to what are then the strategies to strengthen youth engagement. In this slide, you will notice that these 4 individuals here are trying to put together the pieces of a puzzle. So what are those strategies we can use to strengthen youth engagement in AMS? One is to build capacity of youth through training, mentorship, and workshop. And like I said, this should be sustained, not just a one-off campaign. Integrate antimicrobial stewardship into curricula at secondary and tertiary levels. Another important thing is to forge partnership between youth, governments, NGOs, and private sectors. Leverage digital platforms. Social media campaigns can reach millions, even in the rural areas. Is an advantage that the youth have because they have that quick access to the media. So that's advantage should be leveraged. Strong enforcement of veterinary and human antibiotic relationship. Picture this with me. In a Nigerian secondary school, students host AMR awareness days using TikTok skits to debunk myths about antibiotic misuse. Now, on the other section, you see farmers in rural Kenya learning from peer-led workshop and seminar on how to cut back on animal drugs without losing their livestock. Somewhere in Johannesburg, the urban youth spark viral debate on social media, urging doctors to prescribe wisely and responsibly. Government in all African countries enforces strong veterinary and human antibiotic regulation. Now, if you see if these things happen at the same time, you will see there will be a drop on the impact of antimicrobial resistance. This is One Health in action, safeguarding human, animal health, and the ecosystem together. Africa, with its rich biodiversity and growing AMR threats, should lead by example. From Lagos to Cape Town to Dodoma, youth should be trained as AMR ambassadors, thereby bridging science with stories that stick. Therefore, a call to action. The image on this screen indicates a symbol of leadership, a symbol of empowerment and guidance. My message today is simple. Youth are not just the future, they are the present. If we empower African youths to lead antimicrobial stewardship, we strengthen One Health. We protect our hospitals, we protect our farms, we protect our environment. We safeguard the health of generation yet unborn. So I challenge every young person here, be a One Health champion. If you have not joined, join today. Use your voice, use your creativity, use your network to fight AMR. Collaborate across disciplines, whether it's medicine, whether it's veterinary science, agricultural, environmental studies, the humanities, all play an important role in the One Health approach. Again, there should be sustained engagement and not one-off campaigns. Together, we can ensure that antibiotics remain effective and our health system remain resilient, and that Africa stands as a leader in the global fight against antimicrobial resistance. I will leave you with this. The fight against AMR is not won in the laboratories alone. It is not just won with advanced diagnostic methods, with PCR and advanced methods. It's not just in the laboratories. It is won in the classroom. It is won in that marketplace. It is won on that streets, in our communities, and in conversations led by the youth. Remember that the youth are energetic and they can make things happen. So let us rise to the challenge for One Health, for Africa, and for the world. These are some of my references which I consulted while preparing this talk. And thank you for listening. Over to you, the moderator.
Thank you so much, Dr. Nancy. That was an amazing session, I must say. Thank you so much, Ma, for that powerful and thought-provoking presentation. You reminded us something very important, that youth are not just the future, we are the present. That statement alone shifts responsibility. It means the time to act is not tomorrow, it is now. So empowering youth for One Health action in Africa is not just a concept, it is a call to responsibility, innovation, and collaboration. And today we have been challenged to step fully into that role. I'm sure I'm going to be stepping into that role. Are you ready for that? That should be your question. And moving straight into the question and answer section, we have some questions in the chat box already. I'll be directing them to Dr. Nancy. If you have more questions, you can drop them we would attend to them shortly. So for the first question, okay, so in the chat box, somebody asked, sorry, I'm trying to get the question here. Okay, thank you very much. The first question says, how can the One Health approach be practically integrated into existing community health and school outreach programs in low resource settings? Dr. Nancy, the question is directed to you. Can you hear me, ma?
Yeah, I can hear you loud and clear. The question is, how can the One Health approach be practically integrated into existing health, into existing community health and school outreach programs in low resource settings? Okay, I will try to attempt this response, but there is no straight one answer here because situation in various communities and countries differ. Now, having stated that, there is an existing One Health approach, One Health activity in a particular community and school outreach. And so the participant is asking, how can it be? Okay, how can the One Health approach be practically integrated? Now, what you do here, One Health approach, when we talk about One Health, remembering it is a cross interdisciplinary approach, collaboration between various disciplines. You have the vets, you have the medics, you have the environmentalists, you have the media people, you have the social guys. This group of people have to come together depending on what the issue, what is the particular issue. What issue are you trying to address? Are you trying to address a zoonotic disease? Are you trying to address a particular environmental issue that affects humans and animals? Or you want to address a particular plant issue or an ecosystem issue? So first of all is, what is the problem? You have to identify what the problem is. And then you now consider how these various disciplines can come together in solving that problem. In low resource settings, we have our communities. In the communities, in communities like, let's say where I am right now, we have youths. We have students, of course, educated ones, non-educated ones. Bringing these people together in a town hall meeting, discussing with them, telling them what, if it is AMR is the issue we're discussing now, what AMR is, what the problem is, what they can personally do each day to reduce the risks. Importantly is to bring the youths together, discuss these matters with them, educate them first. They have to be aware, they have to be educated. When they're educated, they have that knowledge to be able to go out into the communities, even to go out to the school, to carry out whatever program that has been planned out. So what I'm trying to say is that, first of all, you want to identify what is the problem you're trying to address. Is it an environmental problem? Is it a disease problem? Is it a behavioral problem? So when this problem is identified, you will now think of who are the experts that we need to bring in, and then bring in the community. Because whatever you do, whatever approach must be community owned. If the community is not involved, they will not own it. They will not see it as their own. So it has to be community driven. So I hope in one way or the other have tried to answer that. Then the second question I'm seeing here is, what role can young professionals and community advocates play in strengthening outbreak preparedness using the One Health approach? What role can young professionals and community advocates play in strengthening outbreak preparedness using One Health? It all boils down to the same thing of education and awareness. Education and awareness. These young professionals, these community advocates, first of all, need to be trained on what the particular, which disease are we preparing for? Is it anthrax? Is it rabies? Is it COVID? Is it another COVID? Is it another pandemic? They need to be trained. They need to be aware. Now, when they are aware of what particular problem it is, the preparedness, because for each disease, for example, there is a preparedness plan to follow up for each disease. It is different from anthrax. Anthrax is a bacterial disease, is a zoonotic disease that affect animals, affect humans, and affect the environment. Because if the bacteria becomes stays in the soil, it will go beyond the individual. Within the individuals around in the community, it can be affecting somebody that is even far away from where the outbreak must have happened. So taking that, for example, the preparedness plan for such a disease is different from rabies, is different from any other disease. So what is the disease? So when this is identified, the preparedness plan is followed, and then the community advocates, the professionals in the community will go on to educate the community that this is this happened, and so we are preparing for the community need to be prepared for for this outbreak. For example, a case of African swine fever occurring in a neighboring state. Occurring in one state, the neighboring state should not wait until the disease gets reported in its own state. It has to begin to prepare for a response. And so with that, via media campaigns, the radio, the newspaper, social media, letting people know that there is a problem. When you see this thing, please report to the nearest hospital, please report to the nearest veterinary clinic. Like I said, the problem needs to be identified, and then the particular preparedness plan for that problem will be followed. I hope I have tried in one way or the other to answer your question. Are you there, moderator?
Thank you very much, Ma. Thank you very much for that answer.
You're welcome.
I believe the person who asked it must have gotten all they need. You identified the fact that we should find a specific problem within the community and open discussing the issue, and also making community-based actions alongside personal responsibilities. Thank you so much, ma'am. So,
thank you.
Taking the last question. Okay. Every other question will be addressed later. We'll move now to the panel section. From here, I'll be handing over to Bright.
Thank you very much. Yes, I am. Thank you very much, Ms. Moderator, and thank you, Dr. Nancy, for building on that. Indeed, youth engagement in AMR stewardship can really drive awareness and behavior change. So every youth that is on this call that is listening to her, please, this is a call to action that we should go back and create impact. Thank you for that great work, our speakers and moderators for the first and second session. Your contributions have really set a stage for today's discussion. I'm certain each and every one of us has something new about One Health, and there will be impactful change post this summit. Let's move on to the next segment. We'll be shifting gears. We are excited to host a panel discussion with someone or some people very amazing. They are One Health experts. Please welcome Dr. Ahmed Saeed. He's a public health researcher and the co-founder of VetBridge Network. Next, we have Damilola Adesoyi, who is the program coordinator of One Health and Development Initiative. We'll also be hearing from Dr. Chiwendu Esther, who is the founder and executive director of T Foundation for Climate Change and Health Equity. They'll be giving us insight on youth driving One Health in Africa stories of impact, challenges, and opportunities. Please, due to time constraints, we cannot answer all questions from the session, but for any question you have, please drop it in the message box. And while you're doing that, please drop your email as well so that you can be the response can be given to you or sent to you directly. Mr. Jeffrey, please set the pace so we can dive into the panel session. Thank you very much. Mr. Jeffrey, are you there?
All right, good evening. Can you hear me?
Yes, we can.
Okay. Yeah, please, I have a bit of network issue, so I didn't hear what you said last. Can you go over again?
I was just introducing you and telling you to set the pace. Let's
Okay,
carry on with
thank
the
you.
panel session, please.
All right, thank you. So I'm starting with Dr. Ahmed Said Olaide. Yeah, his journey has inspired us in the One Health space, and we'll be hearing from him this evening too. So to start, Dr. Ahmed Said Olaide, please, we'd love to hear about your journey into One Health and what inspired your work before I go over to the questions we have for you tonight. Over to you, Dr. Ahmed Said. Hello, can anyone hear me?
Yes, you're quite audible.
Okay, thank you. So, Dr. Ahmed Said, please can you kindly speak? Please, if you are already speaking, your mic is muted in case of that. Okay, my fellow moderator, please can you confirm if he's on the call? Because I'm currently checking and I can't see him yet. Okay, so I think he's not around on the call yet because I can't see him. So while we wait for him to join us, I'll be moving over to Damilola Adesuye, who is a public health microbiologist. So I'll be moving over to his question. Sir Damilola, please, are you on the call?
Good evening, Jeffrey. Good evening, everyone. Thank you for having me. Yes, I'm on the call.
Okay, thank you so much. So I'll read over your question for this panel discussion. So what inspired your journey into One Health? No, the question is, what inspired your journey into AMR advocacy and One Health? And why do you believe youth must lead in addressing this challenge? That question is directed to you, Sir Damilola.
Okay, thank you. I'd say fear did. Fear. Perhaps I think that's the right word that comes to my mind because I got to know about AMR in my second year during a lecture, and I was really surprised that such thing exists that you take medications and instead of the medications working for you, the pathogens break them, and some of them even use the makeup of the medications for their own use. They use it as their own metabolites. It was really scary. Let me use that word. So I got interested in it. I decided to sort of read more about it and learn more about it. And then I got to meet the person who was teaching that class, Prof. Ajayi then. And then I worked with him for about 2 years. So when I was working with him in the lab, I would work on resistant pathogens and I would see on plates the inhibitory zone so small. And I imagine how it would be like, if people are infected with these pathogens and they can't just get this antibiotic. And then relating it to the fact that, some generations have been affected by antimicrobial resistance in a large range in Nigeria. For example, there is anti-malaria resistance that started when we couldn't use atamycin medications anymore. And we had to start using combo drugs, atamycin and lumefantrine. That is a lived experience. So you'd say that experience and the fear of what could happen, started my journey in it. And I felt like there was something I could do about it because people didn't know, and I wanted people to know about it. So why should youths be interested in it? Why should we be concerned? Well, in my own view, simple, we will suffer the most if things get worse. That's just it. Our generation and the ones to come will face the largest, the most negative impacts of AMR. So if we don't do something about it, we are the ones that would bear the largest brunt of it. Thank you. Over.
All right. Thank you so much, Daminola Adesui, for that insightful session. Yeah, so I will hand over to my co-moderator to take over the next question, which is directed to Farm Dr. Esther Amos. Over to you, Ms. Bright.
All right, thank you very much, Mr. Jeffrey. Thank you very much, Mr. Damilola. It's impressive what actually inspired you to get into AMR. So I'll be directing this question to Dr. Esther Amos. What inspired you to focus on climate change and health? And when did you realize it is a serious health crisis, not just an environmental issue?
Hi, good evening, everyone. Can you hear me?
Yes, please, you're audible.
Yes, we can hear you.
All right, thank you so much for the question. So my story is quite different. So I got into this climate and health space 3 years ago. Yeah, so I'm a pharmacist, but I've always been interested in public health, and I wanted to do something different, like something that not everybody's doing. So I remember I was researching one day and I saw I think it was Jeff Bezos, Abi Elon Musk. He made a post about investing so much in climate change, and at then I didn't really know so much about climate change, so I was really intrigued and I researched further. And then I came across this course, climate science. I downloaded the app and I started learning about climate change. And during the course of the modules, I came across a section where they talked about health, and I was very fascinated. I never knew that climate change could affect health, so I started reading more about it. And it wasn't so detailed; it just gave a brief overview about how it affects health. And then after that, I researched more. and I came across another course, the health impact of climate change. That was in the year 2024. Yeah, I came across that course. It was a paid course by Harvard University, so I paid for it, and I started learning more. And that was more detailed. Yeah, they gave so much examples and real life cases about countries that are actually suffering from it, and it gave like projections of what will happen in the next 20 years, in the next 30 years, in the next 100 years. And also Nigeria, they talked about what will happen in our country, Nigeria, if like nothing is done. And I didn't even know about all this up until I took that course. So I said, okay, since I didn't know this up until now, I'm sure many people don't know about it. So it led me to start my initiative. Then it was Climate Health Mentors. So the idea then was just to educate people about climate change and how it affects our health. That was just it then. And then I remember when I was in the northern, one of the northern countries here in Nigeria, I think in February, March, there was this serious heat wave. And I started having heat rashes. I didn't even know it was because of the heat wave. It was so bad. And the indigens there, like they're already used to it. So they were telling me that it's because of the increase in temperature. So I had to get a dusting powder. Like every day when I'm going to work, I'll apply dusting powder on my face and on my body. Like I didn't even care about what people would think. I was just protecting my health. And then it dawned on me that this is actually really a real thing. Like, and it's going to get worse. So like reading more and learning from other people, resources and all that, like it was a turning point and made me realize that this is not just an environmental issue, but also a public health issue. So like all this information made me to start my organization, and like I said, we started as a climate health mentor, but like we began to grow and unfold and take up like bigger projects to where we are right now. So that's it. Thank you so much.
Thank you very much, Doctor. I like the fact that you had a problem and you went forward to find a solution. And the entire summit, we have been exploring the role of the youth. We'll be getting into the role of the youth as catalysts in change. It's clear that young people bring fresh perspectives and energy to One Health challenges. But what does it take to tap into this potential? So, Dr. or Mr. Damilola Adesuyi, this question is directed to you. Through the African Youth for AMRE Communication Project, what practical actions can young people take today to combat antimicrobial resistance?
Thank you. So just to give a bit of backstory, the African Youth for AMR Risk Communication YAC initiative, now Youth for AMR Risk Communication and Action, it came out of the fact that we youths are quite passionate when we care about something, right? Yeah, we are quite innovative in how we pass across our message to people when we care about something. And then the idea that if we just get the right training and then the resources to get things done, we'll do a whole lot in our communities. So I believe strongly that youths can drive behavioral change. And that's because we know the communities that we are in. We have a grounded understanding of realities in these communities. And we also have the energy and the passion to get it done. And we're quite innovative in how we pass across our message as well. You can see that in social media trends and the likes, how innovative we can be sometimes. So a combination of all this means we can drive behavioral change. So through the YAC project, there are several things. The primary thing I think youths can do is to drive behavioral change, particularly through effective risk communication. And one good point that program brings to youth is that they get to develop competencies in risk communication, in how to communicate to different audience, how you can do the proper community engagement, how you can do the proper baseline evaluation of your targeted audience to get an understanding of what their current perceptions of things, their preferred communication mode, the right word, the right messaging to use in places like that. So I would encourage youths that are here to further follow this program because, of course, we'd have more cohorts of it. And we are very much intentional about training youth to communicate AMR the right way. such that they can drive or facilitate behavioral change. And aside from this, I know there are other communication, risk communication initiatives, trainings that are for youth. So right now, if you're interested in AMI education, if you want to drive change in your community, start thinking of these initiatives where you can volunteer. Start looking at this mapping, this capacity building opportunities for yourself. And when you are volunteering, please don't just do it for the CV, because I think it's something that sometimes becoming a trend. We're trying to raise our profile as much as possible, do our personal branding and stuff. So we lose sight of the real reason for volunteering. Volunteering develops you. It's an opportunity for you to give back to the community. It's an opportunity for you to build capacity, your own capacity. That's the main important thing. So don't just do it for the CV, but vested in it. I can tell you that people you work with will know the difference whether you're absorbed in something or not. And that opens doors for sure. I am someone who has benefited from volunteering very well. Just to digress a little bit. Interesting. I got to OHDI. I started working in OHDI through a volunteer position, right? I volunteered. Someone liked the work I did and recommended me for an internship then, which I was able to, do well at. And then I got employed as a research assistant at first. So volunteering can really open doors. It allows you to build yourself. It allows you to place yourself there. And then you from volunteering, you get to explore and you get to learn new things. And that provides the right ingredient for you to be strategic about how you want to approach your project. You have a good clarity of what to do. I hope that answers your question. I sometimes digress when something gets interesting. I hope that answers your question. Over.
Yes, it does. It does. It does. Mr. Jeff, please, can you take over?
Okay. Yeah, thank you so much, Sir Damilola, for sharing your insights on the practical ways youth can take in addressing antimicrobial resistance. It was really insightful. So, having on our midst here is Dr. Ahmed Said Olaide. We are glad that he's back with us, and the next question will be directed to him. So, Dr. Ahmed Said Olaide, we would love to journey about One Health, and so far, what has inspired your work? Just give us a brief recap of your journey in One Health before I direct your question to you. Over to you, Dr.
Thank you very much, Jeff. And I'm sorry for the network interruption. I would say the network is very beautiful here in this part of the country. So, without wasting much of our time, because I've wasted a lot of time already, to answer your question, what has inspired my journey into One Health? And I would say, my Oga is on the call, and Damilola, and I would say he has been part of what also contributed to my journey to One Health. So when I'm talking, I'll make mention of some intersection we've had in the past. So for me, I would say One Health did not just start from the classroom for me as a veterinarian, or let me say as a veterinary student back then. Didn't really grab the concept from the onset, but I would say it started from something like a discomfort, like being curious about a situation. So I remember when I was a veterinary student, I think in my year 3, yes. So when I went to the abattoir for my feed practice, or is it IT internship that we call it, then I noticed a lot of unethical things being done over there. We condemn a lot of lungs, a lot of infected part of the animals, and then somehow some people still manage to take it out of the place, still sell it. And I read a lot about it, that this thing sells higher in the market, blah blah blah, the public health concern. And I realized the people who even care for actually care less about themselves. Should I call it ignorance? So then I was in the abattoir watching how drugs are being used casually, especially in the cattle markets and various other segments. And I remember when I was growing up, when when you have cough, catarrh or something, the first point of contact is for you to take drugs, majorly antibiotics. And also, when we have diarrhea, you take flagyl, all these antibiotics casually. Like, it's just a normal part of us. So let me say, it's more of like what I grew up with. And I saw that we use this thing routinely without proper diagnosis. Aspect of when I realized veterinarians actually play a critical role. Yeah, we've always been reading it in the book, in the text, that veterinarians will play a critical role in the intersection, blah blah blah, of One Health. But when I came to the actual realization was when I had a practical encounter with my other colleagues in the medical profession when we had the interprofessional and think antimicrobial resistance awareness week in 2022 or 2023. So when I interacted with them, and that was the question they asked me: what roles does a veterinarian or veterinary medicine play in this program we're about to have? And then I thought I was to represent the veterinary profession as the president of the association. Then I asked a question: where do you think illness, infections, resistance actually start from? Majority of the participants, the medical, pharmacy, nurses, and even laboratory scientists, they responded by telling me, oh, maybe when you come to the hospital for treatment, that's when they believe you start feeling sick, you need treatment. And I said, no, I believe it started from our daily, day-to-day consumptions, what we put into our body, because we consider what we eat as a medicine that nourishes the body. So I think what we consume every day is actually a critical component on how and what kind of infections, what kind of resistance we're going to be having in our community. And to buttress that, I said, have you ever noticed whenever you are eating egg, you taste antibiotics in it, or in a meat that they did not observe a withdrawal period? Or have you ever noticed a situation whereby you've never used a drug before and it didn't work for you when it was recommended? How do you think you come across it? That is resistance. And it all comes from what we eat. And veterinarians are at the forefront in safeguarding these particular concepts. Or we play a critical role in ensuring we limit how resistance, infections, and every other One Health concept have been transferred from humans and the environment. So that moment actually changed my perception on the critical roles veterinarians actually play in One Health. And I made mention of something. That was the moment I stopped seeing myself as just an animal doctor, as many people used to call us. So I began to understand that veterinary actually sits at that critical intersection: food system, livelihood, and public health. And I used to tell people, if we ignore prevention at the animal level, we are indirectly contributing to human health crisis. And that realization actually shaped everything I choose to work on afterward. I choose to see myself beyond just treating the animal. I see myself policing the public health in the community. And I'll give a recommendation, a kudos to One Health, OHDI as well. They play a critical role in me realizing how veterinarian play a critical role in One Health. And then my Ogadamin was actually part of the people that made me realize when we collaborate, we work together, and then was able to see beyond me just being the animal doctor. Thank you.
All right. Thank you so much, Dr. Ahmed Said, for that wonderful insight on how veterinarian can play a critical role in both human and animal health. We truly appreciate your wealth of experience and wisdom. So right now we'll be moving. I'll be handing over the floor to my co-moderator to continue the session.
Thank you very much, Mr. Jeffrey. Thank you, Dr. Sahi. Thank you for reiterating on the point of interconnectedness. As I said earlier, The problems are connected. Why don't we connect the solution? So we'll be moving forward to something related to that, challenges and barriers. Implementing solutions is rarely easy. Let's explore the main obstacles. So Dr. Esther Amos, what are the biggest barriers to implementing climate health interventions in underserved communities, and how can young leaders help overcome them?
Okay, thank you so much for the question. Without wasting so much time, I think I'll just talk about very few barriers. The first is, okay, not really the first, but one of the first I'd like to talk about is climate health, low climate health literacy. Yeah, like many people are climate illiterate, that is, are not even aware about climate change or how it affects our health, and that is a very big problem. I think statistics, I don't know the year, but recent statistics shows that about 70% of Nigerians are climate illiterate, while 50% of health workers in Nigeria are also climate illiterate. And now that's like more than half of the people in the country. That's in my country. So how do you want to solve a problem that you're not even aware is a problem? So that's like one of the barriers. So we have to start from the foundation to even to educate them and make them aware of something called climate change and environmental change and how it affects our health. So that's like the solution. To educate people, it should be embedded in schools, even in primary health cares and hospitals. The health workers should be aware. And when people come in and complain about some cases, you can say, okay, yeah, maybe because of the increase in rainfall or increase in temperature, that's why you're having this. So like it starts from the education first. You educate them, and then they can now start preferring solutions to it. That's my one of the barriers. And then also I'll talk about the exclusion of communities from decision making. Yeah, so now let's say that they're all aware now. They're all aware, they're all educated about climate change and how it affects their health. Now you're making a solution for these people, but you're not carrying them along. They're not involved in your decision making. They're not involved in your solution solving, like your problem solving rather. I remember when I was carrying out, I think last year, when I was in a community in the Middle Belt, I was trying to solve a problem. So I was thinking, okay, yeah, the major problem there was borehole. They don't have water, so lack of borehole. And then I went to a community and I was asking them, okay, so I'd like to drill a borehole for you guys, and I'm sure that's what you want. And then they were like, no, we don't want that. We don't want you to drill a borehole for us. And I was very surprised because almost everybody in that local government or in that state, they have like water problem. But now you're telling me that you don't want me to drill a borehole for you. So what do you want? And they said that what they want is road construction. That when it rains, the road is flooded and people don't pass because of that flood. So what is very important to them at that particular point is you constructing a bridge for them. So now imagine I had not asked them. I just came and assumed that okay, because of 10 communities lack borehole. So this one community too, we also lack borehole. Let me come and do a borehole for you. Like they may not really appreciate it so much because that's not what they need at that point in time. So carrying people along in your problem, when you're preparing solutions is very important. They should not be excluded. I think that's what many people do. We just, oh yeah, you will need this, so we shove it down. And it doesn't work like that. You have to carry them along. And then the last one I'll talk about, which is everybody knows, is lack of funds. There's no money. You want to carry out a project, but then you don't have money to carry out the project. So it can really be a very big challenge. Yeah, like I know there's been an increase in the budget in Nigeria. I think about 3-4 years ago, there was very little funds allocated to climate and health. But currently, I think about 15% of the budget has been allocated to climate and health in Nigeria. But however, out of that 15%, what is released is, I think, 4% to 5% of it. So it's still not enough. Even if there's been an increase compared to like 3-5 years ago, but still it's not enough. So it can be very discouraging. Like you have a very big problem you want to solve, but then you don't have money to solve the problem. So I think my solution, what I would like to like advise people, what I really tell people is start from where you are. You don't need so much. You don't need to know Tinubu to solve a problem. You don't need to know the governor of your state to solve a problem. We can take a step. Yeah, like when you want to apply for grants, they always ask, what have you done? Many a times they don't want people that have idea. They want people that are already doing something. So like even if it's just to educate one person and take a picture
and then talk about it. It's actually like really good. You don't have to have so much, you don't have to have up to 1 million naira to solve a problem. Even if it's 10,000, go to a school, educate the students there, and go to a community or a primary health care, educate the health workers there. It's very important. You take pictures, and from there you scale up. So I think these are like the three barriers I talk about: the limited finance, climate illiteracy, and exclusion of community members from a decision-making process. Thank you.
Thank you very much, Dr. Esther. You just set the pace, and it's good that everyone should include the grassroots communities when solving problems. Those who have the problem should be included in the solution-making process. And indeed, we don't need to know big people to start solving a problem. You can start small, and before you know it, you'll be making global impact. So this question is directed to Damilola Adesui. What are the biggest barriers to addressing AMR in Africa, and how can young professionals help to overcome them?
Right. Am I audible?
Yes, you are, please.
Okay. First, I want to say that please ignore anything Dr. Said says about me. He has his way with words, right? So what are some of the biggest barriers that we have? I'll just mention two that I think. The first one is education, right? I think it's something that has been mentioned as well with regards to climate change. And the same thing happens in AMR too. People are not aware of what they should do. They're not even aware of AMR. And interestingly, people have lived through AMR experiences. You would hear of persons in communities where there is one infection that is there for long. They've used several medications, it's not working, and then they say, oh yes, it's because of the village people. That is why the infection is still. And if you actually culture, you actually get some. We all live through in Nigeria, from using atomizing to now combo-based anti-malaria medications. So these experiences, people don't associate it with AMR. So there's that lack of awareness on AMR. It's a major thing. So I think it's something that we youths need to start thinking more of. We're already doing it, but it's something we need to start doing more of. For example, I grew up learning about HIV. It was in the school curriculum. I knew what to do about it. And that helped me to prevent myself from contracting it. Can we have something similar? Can we advocate that AML should be embedded into our curriculums, into school curriculums? People don't just learn about AML outside of the formal education settings. It's not so easy to do so. But if you want an AMR-aware generation, a continuous and sustainable way of AMR education, we can embed it into curriculums and ensure that infections, talking about pathogens, we mention resistance, antimicrobial resistance into it. And we know how to use antimicrobial as well and guide them well. So that's the first issue that I think should be treated with urgency, including AMR education into curriculums, prioritizing it in our national action plans. And of course, we need systems. We need systems a lot. You can't tell people to change when there are no systems in place. I think that's one of the things that was mentioned, that has been mentioned in this conversation, right? You can't tell people to change without systems in place. If you tell someone to wash their hands, I think Dr. Nancy also mentioned the other time, if you tell someone to wash their hands, I don't have soap and water, what would they use to wash their hands? So you need systems in place. She mentioned some of the systems that she met over there where she went to. Some of them you might see we don't have. For example, in several African countries, OTC sales are available, are allowed, even for antimicrobials or antibiotics that are in the WASH and even reserve list of their aware classification. That should not be so. You see several antimicrobials that are not supposed to even be in open market. Everybody can access it. Everybody can purchase it as long as they have the money. And some of them are even substandard. the proliferation of our pipeline, our supply. Aside from that, access to good primary health care. If you can't even trust PSCs in your communities to provide the basic health provision for you, it becomes a concern. You're not able to trust their advice. You're not able to easily access health care. You are more likely to go and meet a patent medicine vendor to get antibiotics just to use and self-medicate. The UAC coverage as well. People often spend out of pocket, and it makes it hard to access antimicrobials, particularly some antibiotics that are quite expensive. It is hard to access that medication, to access the health care needed. So in short, we need systems in place that support behavioral change. Just to reiterate again, education, integrating it into school curriculums, and then providing systems. Change does not happen without system. So now, as I'm saying these things, as young persons, can we start thinking of what we can do towards this? Of course, we would say advocacy, but when you are creating, let's say you're implementing a project, you're designing a program, can you start thinking of a system issue that will prevent that program from achieving the right aim? And then start thinking of what you could do about that system issue, what you could highlight to the funders, such that you tackle the system issue there. And then whatever education, whatever communication you pass to people, they're more likely to uptake it because they have enablers that will make them do it right. So I'm just picking those 2 points from the works I've done, and then my perspective as a risk communication person. Yeah, over.
Thank you very much, Dr. Damilola. For every youth here, if you're looking for a problem to solve, then in One Health or in giving you some problems and the ways to go about it. Thank you very much. So directed to Dr. Ahmed Sahid, what gaps exist in farm biosecurity and disease prevention, and why do these gaps persist?
Okay, thank you very much for the question, Asper. Can you confirm if I'm audible?
Yes,
Can you hear
are.
me? All right, thank you. Okay, you said what gap exists in farm biosecurity and why do they persist? I'll say one of the biggest gaps that exists is structure. It's actually not ignorance per se, it's lack of structure. Because when we talk about biosecurity, majority of the farms we have in Nigeria, for example, they are informal. Majority of the farms that supply larger percentage of what we consume in Nigeria, they are informal, they are backyard. People just stand up one day, oh, I want to start raising birds, so I want to start raising cattle. It's structure. There's no structure. And most of the times, regulations exist only on paper, but they are rarely enforced. You will hear people don't sell antibiotics, don't sell drugs, don't sell so to people unless they get a certified veterinary recommendation or they get a letter from so, even in human medicine too. But majority of them are not being enforced. You see people with all these third generation antibiotics being in the hands of the farmer, being in the hands of just anybody. They have no knowledge about what they are doing. And also, farmers are always under economic pressure. When there is a problem, when there is an outbreak, farmers tend to cover it because there is no compensation. If I know I'm going to lose, I know these animals or whatever I'm rearing, there is an outbreak. Maybe there is avian influenza, blah, blah, blah. Instead of me to report it to the right authority and for them to condemn everything and I will lose 100%, why don't I just slaughter it, sell it at a lower price to the masses? And we know there is poverty in the land. Many people will jump into cheap over. So from there, disease tend to spread. Biosecurity tend to be break along the line. So farmers are under economic pressure, and we have a very weak surveillance system. And I can't even count the number of states that have a very good disease reporting system in Nigeria. Even if there is, we don't even know the channels. How many of us even know the channels of disease reporting when you notice there is an outbreak? Everybody is just on their own because the surveillance system is also very weak. there is a breakage in biosecurity at a particular location, maybe at a particular farm or a warehouse or a processing facility. But then, who are the people monitoring it? There is none. And only few states have a strong surveillance system in Nigeria. And honestly, prevention doesn't attract funding the way outbreaks do. Yes, government hardly pay attention, or even individual, we as a person, even we as advocates, and that we tend to call ourselves we are sensitizing the people. We don't pay much attention to prevention. Everybody pay attention, oh, and that is what put fear in the mind of the people. Oh, there's outbreak of anthrax, don't eat momo or the hide and skin. That is when people tend to comply. When there is an outbreak, when there is already a problem, rather than we laying more emphasis on prevention. So prevention doesn't attract funding. Even funders, when it comes to research, they tend to fund the one that there is outbreak already, that is affecting the people. We tend to put more emphasis on the outbreak than spending extensively on prevention. Do you get it now? And then we react dramatically to crisis, and we invest minimally in avoiding them. That is the nature, especially in low middle income country, which Nigeria fall under. A lot of people, if you ask people, oh, be washing your hand before you go out every day, nobody will answer you. But tell them there is COVID or there is a problem that is killing people out there, people tend to comply immediately. So we react dramatically to crisis. Everybody become the expert. Everybody tend to care for themselves when there is a problem. But can we actually put the same effort in preventing the same problem? So I see until biosecurity actually becomes embedded into how livestock production is structured, not just advice, all these gaps will actually exist. And this is one of the reasons where I came up with the idea of the biosecurity, about bioshield initiative in the first place. A lot of people focus heavily on the human aspect of One Health, while neglecting the other important aspects, the animal and the environmental. Especially the environmental has suffered extensively lately. But the human and the animal aspect also need attention. We need to come up on how we can prevent this problem from occurring. Both as we are trying to sensitize the human, let us sensitize the handlers of the animals too. That's why we come up with the biosheet. And that's why biosecurity, it is very important, both in humans, in animal, and in conserving the ecosystem as a whole. So what I see is regulation actually is very poor. They are not enforced, and a lot of us don't pay attention to it. So we prefer to react majorly to outbreak than to prevention. So those are the gaps that exist in farm security, and that is the reason why they persist. Because a lot of people, humans generally, we don't pay attention to prevention. We rather act swiftly to intervene when there is a outbreak, when there is a crisis already. So those are the gaps that exist, especially in farm biosecurity, and those are one of the reasons they still persist. And in order for us to be able to actually manage this crisis together, then we need to come together holistically, encourage biosecurity, encourage prevention, encourage adequate nutrition, and discourage people from relying so much on drugs. And then, to be honest, we can all achieve the whole concept of One Health together. I hope I've been able to respond to your question.
Yes, adequately, Dr. Ahmed. It's very sad that people are more invested in the outbreak than the prevention. They usually say prevention is better than cure. So if we can invest more in ways to prevent the disease from occurring in the first place, I don't think we're going to have so much problems when there's an outbreak. Earlier, we had a quick check-in to set the stage for our discussion. Now that we have wrapped up the summit, we would love to hear your thoughts. Please take a few minutes to complete the post-summit survey. Your feedback is crucial in helping us shape future events. Thank you in advance for your input. As we bring today's summit to a close, I want to express my deepest gratitude to each of our phenomenal panelists, the attendees, the speakers, and everyone here for fueling
This critical conversation on youth as catalysts in change and every other thing we have spoken about today, your passion and insights have truly set the stage for meaningful action. A huge thank you to our organizing team for making this happen. Tomorrow promises to be just as impactful as today. As we dive deeper into shaping One Health action plans, join us same time tomorrow and we'll make impact. Thank you very much.
All right. Thank you very much, everyone. My co-moderator, are we done?